May peace be on all of you. Myself, Dr. Majid Khan, Associate Professor, Loknetri Dr. J.D. Pawar College of Pharmacy, Kalwan, Nasik. I will welcome in this chapter lipid lowering agent. In previous lecture, that is lecture 1 of lipid lowering agent, we already cover biosynthesis of cholesterol, its metabolism, lipoprotein, and its two different pathway of metabolism. Now, in this lecture 2 of lipid lowering agent, we will cover classification and HMG-CoA reductase inhibitor. The learning outcome of today's topic: after completion of this topic, student able to remember the classification of lipid lowering agent, know structure activity relationship of HMG-CoA reductase inhibitor, understand mechanism of HMG-CoA reductase inhibitor, draw a structure of important HMG-CoA reductase inhibitor with IUPAC and their uses. So first one is classification of lipid lowering agent. So there are three classes. First one is bile acid sequestrant, example cholestyramine and cholestyramine. Second one is HMG-CoA reductase inhibitor, example lovastatin, mavastatin, simvastatin. And third one is fibrates, and that clofibrate and fenofibrate. So there are three classes of lipid lowering agent, but in this lecture or in this video we will cover only second class, that is HMG-CoA reductase inhibitor. Remaining two, that is bile acid sequestrant and fibrates, we will cover in lecture 3 of lipid lowering agent. So now let us start. HMG-CoA reductase inhibitor. HMG-CoA means hydroxymethyl glutaryl CoA. So HMG, full form of HMG, hydroxymethyl glutaryl CoA. So HMG-CoA reductase inhibitor, as name indicate, these are the drugs which inhibit the enzyme HMG-CoA reductase. So the development and use of HMG-CoA reductase inhibitor begin in 1976 with discovery of mavastatin, originally named compactine. It is a fungal metabolite isolated from two different species of penicillium and demonstrate potent competitive inhibitor of HMG-CoA reductase. Its affinity for this enzyme can shown to 10,000 times greater than that of substrate HMG-CoA. After several years, a structurally similar compound was isolated from Aspergillus species known as lovastatin, which is more potent than mavastatin. So here if we see the structure, so it is the structure of first drug, that is mavastatin is the first drug which is a fungal metabolite, and it have the ability to inhibit the HMG-CoA reductase enzyme. Then after some year, second drug is come into existence, that is lovastatin, which is more potent than the first. If you see the structure difference between these two drugs, there is only CH3 group is different. In case of mavastatin, on 6th position R equal to H. In case of lovastatin, R equal to CH3, that is methyl group. These two drugs are prodrug, means it require hydrolysis. So it is an inactive form of drug. It contains lactone ring. This one is lactone ring. After hydrolysis in vivo or in body, this lactone ring is hydrolyzed into this acid. It is called as active form of drug. So these drugs are prodrug, which is converted into their active form in body after hydrolysis. So in hydrolysis, this lactone ring is break into this and it form the active form. So it is the prodrug. Now SAR of this drug. So for SAR study, common structure of HMG-CoA reductase inhibitor is divided into three components. So these are three components. First one is this one, 7-substituted 3,5-dihydroxyheptanoic acid. Second component is this ring A, whole structure. Third component ring B. So general structure of HMG-CoA reductase inhibitor drug contain these three components. First component is common and second component may be ring A or may be ring B. This ring A or ring B attach on 7th position of component first. So here this ring is attached. It may be ring A type, it may be ring B type, but this structure is common in most of the drugs. So for SAR, common structure is divided into three. First one is this one, that is 7 substituted 3,5 dihydroxyheptanoic acid. Second is ring A, then third one is ring B. So first one, it is a 7 substituted 3,5 dihydroxy. This one is hydroxy group, this one is hydroxy group on third and fifth position. And total number of carbon is 7 with acid group heptanoic acid. So the general name of this part is 7 substituted 3,5 dihydroxyheptanoic acid. Now discuss the SAR. So first SAR of 7 substituted 3,5 dihydroxyheptanoic acid. So it is the general structure of this one part. This 7 substituted 3,5 dihydroxyheptanoic acids. In that first point is 3,5 dihydroxycarboxylate is essential for activity. Compound containing lactone ring are prodrug requiring in vivo hydrolysis, as we discussed previous. So if this ring is lactone ring, then it require bioactivation. So this lactone ring is converted into acid part. So it is like a prodrug. So if any drug contains this ring as a lactone ring, then it is a prodrug after hydrolysis, which is converted into this heptanoic acid part. Second point, altering 2 carbon distance between carbon 5 and ring system at carbon 7 decrease the activity. So here there is 2 carbon between carbon 5 and this carbon 7. So there are 2 carbon, that is ethyl bridge. So if we increase the number of carbon between carbon 5 and carbon 7, then the activity is decreases. So for maximum activity or for optimum activity, there will be 2 carbon between carbon 5 and carbon 7 ring, the carbon 7 ring attached. So this one is carbon 5 and here is ring attached. So there is 2 carbon between these two. Then third one is a double bond between carbon 6 and carbon 7 can either increase or decrease the activity. So if we insert the double bond between 6 and 7, then the activities decreases. So it is the SAR of first component. Now second SAR of ring A. So here is a ring A. So on this 7, first part is attached. So at this position, it is a carbon number 7. At this position, first part, that is 7 substituted 3,5 dihydroxyheptanoic acid is attached here. So it is a ring A. So in case of general structure, this one is R1 and this one is R2. So it is a general structure of component ring A. R1 is this and R2 is this. Now SAR, first point, decalene ring is essential for activity. Decalene means 10 carbon. It is also called as naphthalene. So here number of carbon is 10. So decalene ring is essential for activity. If we replace this decalene ring with simple cyclohexane ring, then 10,000 times decrease in activity. So this decalene ring or naphthalene ring is important for activity. If we replace this ring with simple cyclohexane ring, activity decreases. Second point, conversion of ester side chain to ether result in decrease in activity. So it is a ester side chain. Here is oxygen with carbonyl group and this side chain. So it is the ester type. If we replace this ester with ether, activity decreases. Third point, when R2 equal to methyl, R2 is here, this one is R2. So when R2 equal to methyl group, increase in activity. Hence simvastatin is more potent than lovastatin. So it is a simvastatin where R2 equal to CH3, but in case of lovastatin, R equal to H. So when R1 equal to methyl group, more active compound as compared to the compound which contain hydrogen. So therefore simvastatin, which contain R1 equal to methyl group, is more potent than the lovastatin which contain R equal to hydrogen. Third point, when R1 equal to hydroxyl, this one is R1. So R1 equal to hydroxyl group, CNS side effect is less. Example, pravastatin. So here is R1 equal to hydroxyl group. So hydroxyl group is a polar group. That is, compound is more water soluble, less lipid soluble. And as we know, in order to cross the blood-brain barrier, the compound should be lipid soluble. So here there is a less lipid solubility. Therefore, this drug pravastatin does not crosses blood-brain barrier, and therefore it shows less CNS side effect. So it is about the SAR of ring A. Then SAR of ring B. So it is a ring B. Here is the point of attachment. It is a R7, where the first component of general structure is attached. That is 7 substituted 3,5-dihydroxyheptanoic acid attached here. So it is a total ring B structure. So in case of ring B structure, sorry, carbon 7 is here. Here first component is attached, not here. So here carbon 7 is there, where the first component of general structure is attached. So here is W, here is X, here is Y, and small n, and this one is R3. So in case of ring B, W, X, Y, small n, and this one is R3. So first point, X, W, X, Y may be carbon, may be nitrogen. So this W, X, Y may be carbon or may be nitrogen. When it is nitrogen, then it is called as heterocyclic ring. Our small n is maybe 0 or 1. So when small n equal to 0, it means that this ring is 5-member ring. If small n equal to 1, then this ring is 6-member ring. Keep in mind that when small n equal to 0, then it is 5-member ring. If n equal to 1, then it is 6-member ring. Point number 2, when side chain R3 is aryl group, increase in lipophilicity and inhibitory activity. So when R3 equal to aryl or aromatic ring, activity is increases as well as lipophilicity is increases. The example is fluvastatin and serivastatin. So it is an example of drug which contain this type of ring, that is ring B, fluvastatin and serivastatin. So it is about the SAR of HMG-CoA reductase. Now regarding mechanism of action, so as name indicate, HMG-CoA reductase inhibitor are the agent which inhibit the HMG-CoA reductase enzyme. So as we seen in lecture first about the biosynthesis of cholesterol, and that reaction is start from acetyl-CoA, then it form HMG-CoA, then by the enzyme HMG-CoA reductase it form intermediate and then mevalonic acid. This mevalonic acid after several steps converted into cholesterol. So the important step here is this one, that is conversion of HMG-CoA into intermediate by the enzyme HMG-CoA reductase. So our drug, that is HMG-CoA reductase, as name indicate, these are the agent which inhibit this enzyme HMG-CoA reductase enzyme. Therefore the conversion of HMG-CoA into mevalonic acid is inhibited and automatically the biosynthesis of cholesterol is inhibited. So in summary, HMG-CoA reductase inhibitor inhibit this enzyme HMG-CoA and therefore prevent the formation of cholesterol. So normally HMG-CoA reductase inhibitor mechanism related to this is, first one is inhibition of cholesterol biosynthesis, second one is enhancement of receptor mediated LDL uptake and reducing VLDL precursor. The inhibition of HMG-CoA reductase causes decrease in hepatic cholesterol, which activate compensatory mechanism, that is enhancement of HMG-CoA reductase and LDL receptor. The net result of all these effects slide to moderate decrease in cholesterol synthesis and significant increase in receptor mediated LDL uptake and overall lowering of plasma LDL level. The increased amount of LDL receptor may also increase direct removal of VLDL and IDL, and thus these lipoprotein are precursor of LDL, and this action may contribute to overall lowering of plasma LDL cholesterol. So the main mechanism of action is inhibition of this enzyme, due to which biosynthesis of cholesterol is decreases. Now see the some example of HMG-CoA reductase inhibitor along with their IUPAC name. So here first is lovastatin and simvastatin. So in these two drug only difference is CH3 group on this R1 equal to hydrogen or CH3. So in case of lovastatin this R1 equal to H, in case of simvastatin R equal to CH3. Now the first is lovastatin IUPAC name. So numbering is given here 1, 2, 3, 4, 5, 6, 7, 8, 8A. Here is oxygen 1, 2, 3, 4, 5. Here is also 1, 2, 3, 4. Side chain 1, 2, 3, 4. So in case of lovastatin 1, 2, 6, 7 means here 1, 2, 6, 7, 8, 8A. There is a single bond hexahedro. Then 1 in bracket 1 means this one. So on one position this ring is attached, that is 2, 3, 4, 5 tetrahedro 4 hydroxy. This one is 4 hydroxy. 6 oxo means this 6 oxo. This ring is pyran ring. On second position attachment 2 il. Then this bridge, that is ethyl bridge. Then 2,6 dimethyl, this one is, and this one 2,6 dimethyl naphthalene. So it is a naphthalene ring. 8 il, on 8 position there is a side chain attached. Side chain is 2-methyl butanoate. So it is a 2-methyl butanoate. Butanoate means butane with ketonic group and ester. It is a ester type. So it is a ester group with 4 carbon. Therefore butanoate. So total name of lovastatin 1, 2, 6, 7, 8, 8A hexahedro 1 in bracket 2, 3, 4, 5 tetrahedro 4 hydroxy 6 oxo pyran 2 il ethyl 2, 6 dimethyl naphthalene 8 il 2 methyl butanoate. Second is simvastatin. So in case of simvastatin only difference is this CH3 in R equal to CH3. Therefore in IUPAC name only change is here. In case of lovastatin 2-methyl butanoate, but in case of simvastatin there is a 2,2-dimethyl butanoate. Remaining IUPAC is same. So simvastatin IUPAC name is 1, 2, 6, 7, 8, 8A hexahedro 1, 2, 3, 4, 5 tetrahedro 4 hydroxy 6 oxo pyran 2 il ethyl 2, 6 dimethyl naphthalene 8 il, then 2,2-dimethyl butanoate. So here is the difference. Next drug is atorvastatin. So atorvastatin structure is here. So numbering start from 1, 2, 3, 4, 5, 6, 7. So here is 7 with acidic group, that is heptanoic acid. So on 7 position this ring is pyrrolidine ring. So pyrrole. So it is a pyrrole ring. So 7 means this 7. 2 means this 2. So on pyrrole ring on second position this ring is attached. This ring is 4-fluorophenyl. Then on third position again phenyl ring is attached, 3-phenyl. Then on fourth position this group is attached, that is phenyl carbamoyl. So it is a carbamoyl group with phenyl ring. Then on 5 position this one is propane. 2 il means this 2 attachment 2 il. Pyrrole is a ring, pyrrole 1 il. Then 3,5-dihydroxy. So on this 3,5-dihydroxy heptanoic acid. So total IUPAC name of atorvastatin 7 in bracket 2 in bracket 4-fluorophenyl 3-phenyl 4-phenyl carbamoyl 5-propane 2 il pyrrole 1 il 3,5-dihydroxy heptanoic acid. Next drug is pravastatin. So again pravastatin, this group is same, that is heptanoic acid, 7 carbon with acid group heptanoic acid. So here 3,5-dihydroxy means this one, 2 hydroxyl group on third and 5 position, 3,5-dihydroxy. Then on 7 position this ring is attached. On 7 position this ring is attached, which ring is 6 hydroxy means on this 6 hydroxy 2-methyl means this 2-methyl 8. So here is 8 is this. So on 8 there is a 2-methyl butanoyl oxy. So it is a butanoyl oxy. So again 4 carbon with ketonic group and with oxygen. So butanoyl oxy. Then 1, 2, 6, 7, 8, 8A hexahydronaphthalene is same. 1 il heptanoic acid. So IUPAC name of pravastatin 3,5-dihydroxy 7 in bracket 6 hydroxy 2-methyl 8 in bracket 2 methyl butanoyl oxy 126788A hexahydronaphthalene 1 eel heptanoic acid. Next drug is fluvastatin. So again here is 7 carbon with acidic group heptanoic, but here there is a double bond on position 6, so therefore it is called as heptanoic acid alkene, because it contains double bond, then therefore it is a alkene. So here E, that is heptanoic acid. So on 7 position this ring is attached, it is a indole ring. So IUPAC name 7 means this 7 position, then 3 means this 3 position. According to indole, this one is 3 position. On 3 position this ring is attached, that is 4 fluorophenyl, then 1 propane. So here is propane, 1 propane, 2 eel means this 2 attachment point, 2 eel, indole ring, this one is indole ring, 2 eel, again on indole there is a 2 position attachment, 2 eel, 3,5 dihydroxy, so it is a 3,5 dihydroxy, 6 heptanoic acid. So on position 6 double bond is there, therefore 6 heptanoic acid. Then the uses of HMG-CoA reductase inhibitor. So these drugs approved for hypercholesterolemia and hyperlipidemia. By reducing LDL level, it slow down progression of atherosclerosis. These drugs are contraindicated in pregnancy. Contraindicated means not used in pregnancy because fetus means baby inside the womb. Fetus development require cholesterol as a precursor for synthesis of steroid and cell membrane. Hence may cause lethal harm. Additionally, they are excreted in breast milk and should not be used in nursing mother. So this drug contraindicated in pregnancy as well as the nursing mother. So it is about the HMG-CoA reductase inhibitor. In lecture 3, we will cover bile acid sequestrant and fibrate. So if you like the video, then subscribe the channel. Thank you very much.